The pain in my left knee was so severe that walking up and down stairs was almost an impossible task. I was struggling to play with my grandbabies. I like to walk my dog, and I was even having trouble doing that. I felt like it was ruining my whole day. I was a PE teacher for 32 years at a middle school. I spent quite a bit of my day walking to and from the fields. The golden years became not so golden when this pain started in my knee. And then all of a sudden, because of the pain, I was finding I was having trouble doing my fun things in life. And so I went to see Dr. Barron.
When folks see us for the first time, they're obviously, I think, fearful of what we might discuss. And so I think it's a fragile time, it's a very vulnerable time, and it's a real privilege to be able to walk into that space with people.
It's not just the knee or the hip that we're treating. It's the whole patient, and there's a lot more to chronic pain from a knee than just the knee pain. Making the patient feel complete again is what we're out to do.
Dr. Barron's office staff, from the moment I arrived from my appointment that day, was so professional. I had to have x-rays. His nurse took me back, and she was delightful. He came in with a big smile, shook my hand. He showed me on my x-rays that it was bone on bone and that the pain was because of the arthritic situation going on. He said that he was there to help me, that he was not going to push me into this, but it was going to improve my quality of life. When I heard that, I was ready to go for it.
Any surgery is a big life event, but if we can minimize the impact on the patient's life, that's a huge step in the direction of making surgery less invasive.
And over the last 3 years, we've been able to take what used to be a 3 or a 5-day surgical experience and shorten it down to 6 to 8 hours. So people are able to return to their home, sleep in their own bed, be with their family, and be much more comfortable than they've ever been.
Dr. Barron did my surgery as an outpatient, and I was on my couch at 7 o'clock that evening. I would highly recommend outpatient to anybody that can do it. The quality of my life is so much better with my new knee. I can do stairs like a normal person, 1 foot in front of the other, up and down. I can get down and play with my grandbabies. I can walk my dog, and I golf quite a bit with my husband.
I think it's a great joy for us to be able to partner with people and help them get better from really the debilitating effects of arthritis.
We want them to walk without pain. We want them to get back to the things they love doing, and we want them to feel complete.
I will say that with my new knee and Dr. Barron's help, I have my life back, and my golden years are now golden again.